More than 122,000, that's how many people are living with Alzheimer's disease and related dementias in South Carolina. That number is the latest coming to us from the annual report of the South Carolina Alzheimer's Disease Registry. And a USC professor hopes to do something about these staggering numbers. Joining me now is Dr. Shaun Owens. Dr. Owens, thank you for being here.
Thank you so much for inviting me here.
This is definitely something that, we've been talking about for quite some time, and especially here in South Carolina. Those numbers, 122,000, that's a lot of people dealing with this. So why did you decide for this to be your topic for a research?
So I think it was not only because I do have an aunt who had dementia. I think that was part of the inspiration. But secondly, I seen the same staggering statistics that you've seen. And specifically the fact that African Americans have higher prevalence rates of dementia. And here in the state of South Carolina, if you did not know, Orangeburg, South Carolina has been shown as having the 8th highest prevalence rate of dementia in the entire country.
8th?
So that
Wow.
should capture people's attention, and it sure caught mine. And I said, hey, I need to do something to support not only African-American families living with dementia, but also, people in general.
Right, absolutely. So is this research specifically for USC, or is this something that you're doing outside of that?
So it's a part of my faculty position at the University of South Carolina in the College of Social Work. And it's in partnership with organizations like the Orangeburg Senior Center, and also the Oregon Health Sciences Center, who's doing research using technology to support people to age in their homes.
So what technology are we talking about here?
I know it sounds like something like, it's going to be a eureka moment, but it's technologies that most people already use. Believe it or not, research has shown that we can use off-the-shelf technologies like wearables, such as a smart watch, such as a weight scale, such as a smart pill box. These things taken together can support people who have some type of memory loss to continue their routine activities in their home and age in place day to day. It can also help reduce caregiver burden. So caregivers don't any longer have to worry about, okay, did my loved one forget to take their medication?
That's a good point. A good point you mentioned about the caregivers, because a lot of times many people forget that the caregivers are also going through, in a sense, a loss because they're kind of watching their loved one in some instances decline.
Yes, and this stress actually leads to more chronic illness, such as cancer, such as hypertension, agitating, diabetes, other conditions. Stress is connected to a lot, and this is experienced by caregivers. And you want to negate this. So by providing them with support, or providing people who suffer with memory loss some type of technological support, can also help alleviate the burden on the caregiver.
So Dr. Owens, what do you need? I know a lot of times when people have research, they need participants, they need individuals. So what are you looking for?
So what I'm looking for are African Americans who live in rural areas. We're defining rural loosely. So if you're here in the local area, that rural means places like Eastover and Hopkins. But most of our state is rural. So if you consider yourself living in a rural area, you're African American, you have some type of memory loss, you don't have to have a diagnosis of dementia, but you notice some severe memory loss. And I'm not talking about you walk into a room and you forgot what you went in there for. Not that.
Okay.
So what I'm looking for is people with noticeable memory loss, and those who are willing to sit down with me. All I'm asking for is a survey and 45 minutes with both the care partner and the person who is living with memory loss or early stage dementia.
So how do they find you, Dr. Owens? If there's someone that's watching right now and they're like, what, hey, my uncle, my aunt, or I have a neighbor that might fit that, how do they contact you?
So please give me a call at 803-777-0384. Again, that's 803-777-0384. And I also, in exchange for sitting down, talking with me, and taking the survey, both the care partner as well as the person living with memory loss, I'll provide you with an incentive of a $100 gift card to a retail or grocery store. So that's $200 for the pair.
Wow. Okay, there it is. And so is there a deadline specifically for this?
As soon as possible. As soon as possible.
I got it. All right. Well, Dr. Shaun Owens, thank you for what you're doing and try to reduce those numbers of people living with Alzheimer's and dementia-related illnesses across South Carolina. For more information, visit our website at watch.com.